You are listening to the Julie Parker Practice Success Podcast, where you discover management insights and strategies for your successful dental practice. There are also interviews with key people in the industry who have advice and services to help you and your team achieve great success. Welcome to this episode of the Julie Parker Practice Success Podcast. And today I've got Dr. Trudy Lin. Trudy, I think, is a bit of a legend. She's got a whole bunch of energy and a whole bunch of fantastic projects, and she's achieved a whole bunch of stuff already. And so I've been absolutely delighted to be involved with her and connect with her. We've already had a couple of great discussions, and today is the recording of this podcast episode. And so you'll all learn a little bit more about Trudy as well, if you haven't already, by reading up about her and all of the publications that she's been in. Welcome, Trudy.
Oh, thank you for having me on the podcast.
That's a pleasure. And I really am so excited for this conversation. You're interested in so many different things. But first of all, you are a dentist and you're from South Australia.
Yes, that's right. And specifically, my niche is like special needs dentistry. We're a bit of an endangered species. There's actually only 25 special needs dentistry specialists in the entire country at the moment.
And there needs to be more by the sounds of things.
Oh, absolutely. Like when you compare to the current statistics, so 1 in 4 Australians are living with a disability and 47% of the population are living with a chronic medical illness, which are the two kind of major areas of patients that we look after. So there's definitely a really big need.
Wow, we are shortfalling by a lot when it comes to that. So for all of the dental team members out there that listen to this, when we're talking about special needs, we're talking about mental disability, physical disability?
Yes, so a wide, diverse range of the population. So people with all sorts of disability, as you mentioned, physical, cognitive, psychiatric as well. And then we also look after people with complex medical issues. So people with cancer, experiencing immunocompromise, so like organ transplants, and also the other branches, anyone that faces additional barriers and access challenges to getting care to oral health care. So, for example, trauma survivors or people who have experienced domestic violence, all of those kind of fall into that branch of special needs dentistry, and including under that people who experience severe dental anxiety or phobia are also part of the patient group that we look after.
Wow, what a broad group. Now I'm getting a sense of how needed you are and the other 24 of you. So does that also expand out to people who have been drug affected badly and they've got quite a broken down dentition? Does that fall into that special needs category or not quite?
Yes, absolutely. So because a lot of patients that we look after may have also, from the drug use, they have a lot of dental issues, but then may have also picked up a lot of medical issues as well. So for example, bloodborne viruses like hepatitis or HIV, things like that, which immunocompromises them. And so then that has a very big impact on their general health as well as their oral health.
And is there special training that you go through to become a special needs dentist, or do you just, I'm coming from quite an ignorant space about it all, or do you just say, no, this is an area of focus that I want to put my dentistry services towards, and so I will just make sure that I advertise in that way?
Yeah, I love that question because it is something that we want to raise more awareness about. So there are formal training qualifications. So in Australia, it's a 3-year specialist training degree. So you end up completing a Doctor of Clinical Dentistry as a postgraduate. But having said that, I'm a really big advocate for any general dentists that are just interested in looking after patients that fall into the categories that I just mentioned, to just be open to learning more. There's like various continuing professional development courses. So you don't necessarily need to be formally trained, but then also knowing that there are certain additional levels of complexities and knowledge and skill sets that can assist you in providing care for that population. It can be as simple as reaching out to one of the specialists that has some knowledge in the area, to get some more guidance, and just being willing to look out there for different continuing professional development to really upskill and then broaden the skill set. Because I know that sometimes it sounds like these patients might belong in like a different category, but if you think about it, every single one of our patients that we see on a day-to-day basis could end up requiring special needs dentistry at some point in their life, because, any one of us could become like become disabled or have a medical illness through injury, accident, just getting older, and then that normal process of aging. And so I encourage all dentists to really be open to seeing all of their patients as potentially being under that umbrella. And so therefore really leaning into learning more and upskilling and being willing to look after this patient group.
Terrific. And honestly, when you take it down that path, you start to recognize, and, it's all obvious that all of our patients are different and they all do have different needs. They come in, the ones, here's this interesting thing. There was an SBS episode, called Insight, that Dr. Matthew, who was the former president of the ADA, Matthew Hopcroft.
Yes.
Yeah. And this was a few years ago that this episode aired, and it was called The Dental Gap. And I encourage all listeners out there to access The Dental Gap, play it as a group, as part of a team building process, because what it opened my eyes to, because I think I fall into the category of most dental team members. There are absolutely practices that treat special needs and treat people that kind of fall outside the norm. But I was always part of the normal clientele that come through. And the normal clientele that came through the dental practice was a range between those that come diligently every 6 months. And so they have usually less anxiety, they have an increased level of oral health, and they are less difficult or less challenging, present fewer challenges to treat, all the way through to people who had woken up with a toothache or had a toothache for a couple of days and they hardly ever go to the dentist, but they came in to get this one treated. And we think that's the norm, that's the range of our dental patients coming through. But watching the Dental Gap episode, it really highlighted in my eyes that, oh gosh, we're seeing a snippet of the population. Because I don't know what the current figures are I'd love to know the figures of the number of Australians who haven't been to the dentist in, say, 20 plus years, for example, because they're the ones that aren't coming because of fear, anxiety, there may be shame, money,
yes,
lack of opportunity. Maybe they're remote, maybe they have special needs and they don't realise that they can go to a dentist that is specialised in that area or have that area as a particular focus. And yet they're the ones that desperately need help. They're going through daily discomfort. They've got a dentition that doesn't lend itself to be able to turn up well for a job interview or for a first date. They've got problems with their speech and eating, etc. And you're nodding away.
Yes.
This is the group that made me think, oh my God, I was just seeing one snippet of the population when I spent the last 35 plus years in dental practices. There's a whole other section out there.
Yes, I love everything that you're saying. Yes, I'm vigorously nodding to everything that you're saying, because that's something that I'm very passionate about and actually has led to, I guess, the evolution of my practice in terms of, as you said, it's so true. We actually only get to see a very small snapshot of the population that require help. And the ironic thing is that the people that have the most severe dental issues, the greatest burden of disease, are actually the ones that face the most barriers and the most challenges to getting the care they need, because of lots of different things. Like we could list out layer after layer. There's like physical access barriers for those that have physical disability, but then also oral health literacy barriers, like people that, maybe they come from a different language background, and so they don't have the understanding of how important preventative dentistry is. And so it doesn't come to the top of their list of priorities to actually come and see a dentist. And it's like this understanding that I've had from specifically specializing in looking after people that experience more marginalization and barriers that led me to go onto multiple kind of different passion projects. One of them being that I self-funded the construction of a universal facility for people with disability to live in the community. And that was born out of my passion of going, well, if I've got patients that can't even find a house that they can live in, that physical safety and comfort and their day-to-day kind of in their day-to-day life, how will they ever prioritize ever coming to see me as their dentist? And so that was one of the branches of my passion. And now the more recent branch has been that I've also noticed that there are so many physical access barriers that exclude people from being able to attend a typical dental practice. So I do work in a as physically accessible practice as I can, like in South Australia. But then I also work in mobile dental services where I go to people's homes. And also residential care facilities, because a lot of elderly patients, people with dementia, people with Parkinson's disease, they will find it extremely challenging to be able to make the trip to a dental surgery, let alone to be able to sit in the chair and actually have dental treatment. So that makes a huge difference to their capacity and their ability to now access dental services. And in terms of the home visits, there's a lot of patients with very severe autism that find it extremely distressing to even leave the familiar surroundings of their home environment because of all of the sensory sensitivities that can be triggered at a dental surgery. And I have like a specific passion for that because my youngest brother, Aaron, has autism. And so having that kind of family lived experience and really understanding the challenges from the inside has really led to this passion to now grow this other more out of the ordinary kind of way of practicing, where we're actually trying to break down all of the barriers and being as inclusive as possible in providing access to oral health care.
Gosh, it's pretty extraordinary. So do you think that, how well do you know the other 24 special needs dentists out there?
Oh, very well.
Very well.
Because
Go.
I was just going to say, we're such a small, tight-knit community because there's so few of us. And we have like a academy of specialists in special needs dentistry, which is aimed to help to raise awareness and education and also advocacy around oral healthcare access for people with special needs, but then also upskilling other general dentists that are interested in pursuing special needs as well.
Because from that perspective, when you think about, the norm of the patient coming in, they are dentally literate, they don't have physical barriers to coming in, all the things. And so they are, in inverted quotes, easier to treat than I imagine than some of the other special needs patients who present a lot of challenges, both in communication and how to physically actually get the treatment done and where to get the treatment done, whether it's in a practice or actually at their own home and everywhere in between. That because of the fact that we are all on this journey of getting older and we may be falling into special needs ourselves moving forward, and our patient base is falling into that special needs space in varying degrees, it would be beneficial for any dentist to go down this path and look further into it so they can evolve the way they provide their service with their getting older patient base, I imagine.
Absolutely. I think that's a great point that you highlight. And in fact, I am connected with a few other clinicians that do some mobile services. And it's very interesting because part of how they kind of came their way to mobile services, not necessarily through the special needs dentistry path that I had, but because they were working in general practice. So, for example, hygienists for many years, like looking after their patients, doing that preventative care. And then they noticed at some point, around the point in which they reach their late 60s and 70s, and some of the more like medical challenges kick in or mobility challenges, they started seeing their regular patients start dropping off their patient books and going, oh, what's happening to them? And then realizing that it was because now the physical kind of challenges and barriers, and perhaps them transitioning into a care home, was meaning that they were now no longer being able to access regular dental services. So that's like the oral health therapist that I work with in my practice. That was her kind of journey and story and interest into doing mobile services, because she just was really passionate about going, what about my patients that are now dropping off the radar? What's going to happen to their oral health care? It's even more important now that they're reaching elderly age, because as we know, there are statistics that show that the inhalation of dental plaque is a major contributor to aspiration pneumonia, which is the leading cause of premature death for people with intellectual disability in Australia.
Wow.
And also we know that it affects our elderly population as well because of their increased risk of dysphagia, the swallowing difficulties.
Wowee. And, the older people get, the more medications they're on generally, the more conditions that they end up, suffering from. Usually all of that culminates in, many results, but one of those outcomes is they need dental treatment more frequently than they ever used to before as well.
Yes, absolutely.
Yeah. So all of the 24 other magnificent, wonderful people that are out there doing this kind of dentistry that you know of, with you having a brother who is autistic, is that a commonality? Has there been something in their life that's lent themselves to be more compassionate or more? I don't want to say compassionate; it makes me sound like I'm saying that everybody else is not compassionate, but they've come from a position where they could more strongly see the need for dentistry provided to people who were struggling in their life. Is there a common thread there at all?
Yeah, that's a really cool question, because I really like to kind of like delve in and understand the why behind like what leads people to make certain decisions in their life and things like that. And so, I mean, I can't speak for all of the 20 other 24 because I haven't asked them all personally, but I certainly, of the ones that I've actually asked that question to, every person I think is drawing upon their own lived experience. Like, we all kind of make decisions and are shaped by, you know, our upbringing, you know, our kind of like day-to-day journeys, our experiences, the things that really hit us and resonate with us. And for quite a few of them, and this goes for me as well, I mentioned my brother Aaron, but also like other family members, like such as my grandmother, who I was very close to, who passed away from cancer. And just like accumulation of different other people's experiences and what we see, I think certainly does lend itself to then bringing this passion. I think that's something that we all have in common, which is that we all have a really big passion around that, you know, social justice and equity and every person having the right to oral health care. I certainly see that as a theme. And then having those stories, and potentially some of them have shared that during their time as a general dentist, maybe seeing certain patients and certain patient stories kind of staying with them. So yeah, I certainly think that that is a common theme. And I'm sure if you reached out to any of them, they would be happy to share like what their own personal kind of journey that's led them to the specialty would be.
It's probably a very good idea. As you say, you want to get the word out there and have dentists around the country recognise that, you know, special needs is out there. It's growing bigger all the time, and there aren't enough dentists at the moment to cater for that demand. The demand must be huge.
Yeah, yes. I think it's like really wonderful to see that there is more attention being put on special needs dentistry, just in like the broader kind of conversations, because I'm quite involved in oral healthcare advocacy in general. And we can see that oral health needs was highlighted in the recent royal commissions into aged care and also disability. Also, there was the recent Senate inquiry into access to oral health care for Australians. And so it's really wonderful to see those bigger picture conversations happening as well. And hopefully that can lead to also bringing attention to these really marginalized populations, which really require the most care, but then are having the most challenges accessing the care that they deserve.
So from a kind of a practical perspective, if this conversation is having some dentists and other dental practitioners think, oh, this is an interesting area, from a practical day-to-day process, can any practice kind of convert their facility to be able to treat special needs? What does it mean for the day-to-day as a dental practitioner? How is it different from just doing the standard general dentistry on generally easier people to deal with throughout the day?
Yeah, again, that's probably a question we could talk on for a long time. So I'll see how I go kind of putting it into like really practical steps. I mean, there are a lot of like seemingly little things that might seem really small, but can make an enormous difference to someone who might be seeking care. So, for example, little things like on websites and things like that, making a little accessibility additional kind of measures, such as making sure that the font size is larger, that there's captions on videos and things like that. Those little things can mean the difference between someone feeling like they can reach out versus feeling like, oh, I'm not sure that this practice is going to be able to accommodate for some of the additional needs that I require. So little things like that. Also, potentially just with any patients that come in like to the surgery, just being, I guess, like, well, I'm just trying to think about how to like
how to make it a shorter discussion.
Yeah. So I guess we'll see how we go. But like, I guess like if for those that are in this stage of not having, or maybe renovating or moving to a practice or something like that, or building one from scratch, that's a really great opportunity to just look at little things like universal building design. So I had some insight from that, from my own passion and project I mentioned before about funding the residential facility, which is universally accessible. But little things that, as someone that's been quite able-bodied for most of my life, that I was taking for granted, because I guess privilege is one of those things that invisible to those that have it. So I didn't realize all these things I was taking for granted around physical accessibility. For example, wider doorways and big enough bathrooms to allow wheelchairs into. There's things like that. But then also little things like at the doorway, sometimes some buildings have these little like lips at like the entrances that can sometimes make it a little bit more challenging, a bit more of a trip hazard, little things like that. And then also when we have a doorknob, for example, that's a twisting doorknob as opposed to a lever doorknob, that can cause a bit of a difference in accessibility. And the beauty of doing universal building design is that it doesn't just actually open up access so that people with physical disability can actually come to your practice, but it actually benefits every one of your patients as well. So for example, if you have like a wider doorway, that makes it easier for people to come in with their strollers, and also for you to move in furniture. If you have a lever door handle, if you're coming home with lots of shopping bags, it makes it easier for you to open the doorway. So it's really a plus for everyone. Not only does it create and promote more inclusivity and welcome more of these patients to your practice, but it also benefits everyone else that uses that space as well.
Gosh, it's so broad. I agree. It must be difficult to try to bring it all down to be small, but for people working in dental practices, it might be worthwhile just turning up in the car park and moving through that patient journey, just being very aware, what if I was wheelchair bound? What if I had crutches? What if my sight was impaired? What if my hearing was impaired? What if my arthritic hands couldn't grip a round doorknob? What would my experience be like? And it would kind of halfway go to stepping into the world of what you could do in your own particular unique practice to start making it more accessible to a broader range of people. The powers that be have seen how magnificent you are, because you won the South Australian Australian of the Year award back last year, 2022. Is that right?
Yes, that's right.
And you were also one of the few people that were invited to the Queen's funeral as well.
Oh yes, you've done your research on me, Julie.
Yes, because we're such a superstar. So first of all, tell us about the Australian of the Year award for South Australia. How did you get involved with that, and tell us about the process and the experience?
Okay, how to sum it up? I mean, it's just been very surreal. Like, it was very unexpected, and I had so much imposter syndrome. Well, still do. Like, from when I first found out that I was nominated, to then actually going to the award ceremony and everything that ensued afterwards. I guess, like, when it comes down to it, I think like it was such an honor, but I actually feel like the award and the purpose of the award isn't to personally recognize me, but more for me to now spread the word and put a spotlight on my cause, like special needs dentistry, and use that to then create more conversations around advocacy, raise awareness so that more people are aware of special needs dentistry and the needs that are out there. And I have certainly seen that, like, as a result of the award. So I'm very grateful for that. And that was also like highlighted when the Queen's funeral invite came through, and it was announced through the media, because people, I guess, like this, like, kind of just demonstrates how I think the true purpose of like awards and recognition is more for that bringing a cause to light, is that people would look up and be like, oh, okay, let's see who these people that were invited to the Queen's funeral. And then they saw, oh, this person's a special needs dentist. Oh, I'd never heard of that before. And then they start looking up special needs dentistry. And now, like, it's very tangible, the difference, because even like within our specialty, or I say in our profession, like the dental profession, I would say maybe like 5 years ago or something, a lot of dentists still didn't really know what we do, or maybe didn't even realize that we were an actual specialty. But now, post all of the awards and things like that, I just hear feedback from so many colleagues, the other specialists, saying, "Oh, now when I tell people that I'm a special needs dentistry specialist, they say, 'Oh, I know what that is. Wasn't one of your friends like invited to the Queen's funeral? Like now I know what you do,' like things like that." So, and like we also have seen a lot of like patients as well reach out and say, "Oh, it's so wonderful to have that spotlight again." It's such an honor to be feeling like I've got that privilege to be a representative for not only the specialists, like I just feel like I'm representing the other 24 amazing specialists across the country, but then also for an avenue for my patients that I look after to feel seen and to feel like their needs are getting a spotlight and being heard, and that gives them this hope for the future, that maybe there'll be less barriers for them and then they'll be able to get access to the care that they deserve as well.
Oh, it's just such a wonderful thing. Like you think, oh, when you win an award like that, you're like, okay, dusting yourself off, I can relax for a year now. There. But no, it must have been one of the busiest years of your life this past year.
Yeah, it's been quite a whirlwind. I mean, I think like there's been some really big highs, but also like there's been some like pretty challenging like moments as well. I mean, I've mentioned already that it brought up a lot of feelings of imposter syndrome and things like that. And also, like, I guess there's a lot of like hidden workload that comes with having more of that kind of publicity or public profile that kind of comes to light as well, which me being like, I'm actually quite like a private person. And
Bad
so
luck.
so it's taken a bit of time to kind of really like get settled into that kind of role of being quite visible and representing the cause, and wanting to be a worthy representative as well. So it's certainly been like a really good learning journey for me, because I am quite into kind of leaning into discomfort and things like that. And there's certainly been so much like discomfort over the past year, but then also some really great opportunities to, as I say, like bring forward this cause that's really important, that I'm very passionate about, and feel like, very humbled and privileged to be in that position. And so got to really take it and go with it.
Gosh, it's interesting. I can really see how the imposter syndrome would come into play with something like this, because I think of the imposter syndrome being, I used to own my own practice for a number of years, and that was I don't know, I really enjoyed that, because that's where patients are just knocking on your door saying, "Can we spend money with you?" And I'm like, "Yeah, sure, no dramas, come on in." Whereas when I stepped into the dental practice management consulting world, that's where I'm knocking on other people's door saying, "Why don't you come and spend money with me?" And that's where the imposter syndrome for me came up, and all the discussions I hear around it now through podcasts and colleagues and things, it's from that. Okay, we're on this long entrepreneurial journey, and slowly over the years, you'll start losing that imposter syndrome and you'll start recognizing that you're worth your salt. But when you've won this kind of award, that's bang. Like 1 minute you, in essence, weren't worthy of winning it because you hadn't won it yet. And then the very next day, you've won it. And so what does that do to your identity?
Yeah, that's such a good point, is that there wasn't like this kind of gradual lead up. It was like a one day it was this and next day that. And it was the same with like the Queen's funeral invite. It was like one day you're just still quite anonymous, like things like that. And then the next day you're all over the headlines and, all this kind of stuff. So, certainly it was like a little bit tricky to manage that. But very fortunately, like one of my other like passions is around like, mindset coaching. And so I'm actually like a certified mindset coach, and I offer mindset coaching to oral healthcare professionals. And, the honest truth is that I actually first started pursuing the mindset coaching because I wanted to use it on myself. And I found it like extremely powerful and helpful. In fact, it's one of the things that I attribute for me being able to, I guess, do some of the things that led to the recognition of the award. So the residential facility I mentioned, some of the advocacy I was doing in relation to special needs dentistry, like that really lended itself. I think that it's getting like I was exposed to like leadership coaching quite early on in my career. And I would say, if I look back, because a lot of people have asked me that question, they kind of ask, like, how, what led you to be able to contribute in the ways that you did and then be recognized with your award? And I actually really think the answer was that I was so fortunate to get exposure to the coaching world and access to that resource, which really helped me to up level, upskill, and really reach my true potential. Because it really was key in helping me to overcome some of the self-limiting beliefs that I didn't even realize were there. And then you reach other levels, or you lean into something new, and then it kind of like new level, old devil kind of thing. Like, so, which is why
that's it.
I actually think the imposter syndrome is like a good sign that you're actually still kind of leaning into discomfort and pushing yourself that next bit further.
And you said it right, discomfort. We can't avoid discomfort because we just keep doing the stuff that we're competent in, and there's no space for growth in that area. And taking on big projects, coming up with big projects such as the residential facility, which I'd like to learn a little bit more about, I can see how doing that kind of coaching and training within yourself to make sure you are aware of the things that are limiting you, but also aware of the things that you're capable of. And what's that Marianne Williamson quote, that it's not what we aren't, I'm not going to get it right. It's not what we feel that we'll fail at that freaks us out the most. It's what we think we're not game to think of how capable we actually really are. And when you develop that level of self-awareness about yourself, you recognize it's me getting in my way. If I blew the top off that, what am I capable of? I want to do this residential facility thing. I want to do this special needs dentistry thing. I'm going to just go out there and do it because it needs to be done. I'm working with my passion and where I believe in Buckminster Fuller. Have you heard of Buckminster Fuller?
No, I haven't.
Incredible man. Died, I think, in the early 80s. But he was an American guy, philosopher, inventor, this, that, all the rest, an amazing, amazing man. He had, I think it's 47 honorary doctorates. He was so brilliant.
Wow.
So brilliant. And a lot of people haven't heard about him. But he is known to say that we all need to do what we see needs to be done in this world. That's how everything gets done, because we'll all see different needs. And part of the reason why I was asking about the impact of Aaron, your younger brother with autism, had on your career path, and the other 24 special needs dentists, that all of you saw this is what needs to be done. And so you do it. But it's because of our lived experience, what you mentioned before, that makes us realize that. And so when we can get out of our own way, and you can do something like this residential facility and other bits and pieces that you've been doing in your life that have had such a large impact, that's crucial. That's crucial. That's how we give our gift back to the world.
Yeah, I love what you said there, because it's about, a lot of us, we can see a need and we can see a place where, we would love to see something change in our world. But then the next step after that is that you need to then have the ability, or I think we all have a lot of capability and ability that we just don't realize that we have within us. So the next step is that you need to have that self-belief that you can be that person that actually feels that need or can do what it takes to then fix the problem that you kind of see that you would like to have changed. And that's exactly what happened for me, in terms of when I was at this point in my career where I knew that I wanted to pursue something like special needs dentistry, trying to do these things even outside of my field, like the residential facility, and even helping other oral healthcare professionals to be able to do the same thing with the coaching. It required me to then identify these self-limiting beliefs, which can sometimes be a bit sneaky because they might come in as procrastination or avoidance and going, oh no, I don't have time for that, or that kind of thing. But then when I was very honest with myself and with the help of my coach kind of giving me an objective viewpoint, going, oh, okay, is that really coming from a place of, is that your truth, or is that something that you're kind of using as a very effective procrastination strategy or avoidance strategy?
That's right. Just so I can't actually reach my full potential, so I can't fail from that height. So when did your self-awareness journey start? What kind of triggered it? What age were you? Can you remember?
So when I was accepted into that leadership program, which was 12 months of, we got one-on-one coaching as well as group coaching with a cohort. And they selected leaders from across the organization I was working for. So it wasn't just dentists, it was all oral healthcare, healthcare professionals in general. That was in my third year out after I finished dental school. So I would have been age-wise, you're testing my memory here.
I know, obviously memory's the first thing to go with age.
Do you want me to work it out? Hang on, it might take a bit of time.
That's cool. So it would have been mid to late 20s?
Yes, yeah. That sounds about right. Yeah, but the thing is, like, I feel and this is what's led to my passion to actually look at, I guess, like, my coaching specializes in providing coaching for oral healthcare professionals, is because I think that in our dental industry, you can let me know whether you've had similar experience as well, is that there's a lot of talk around mentorship, but then there's not a lot of talk about coaching within the oral healthcare industry. And so I wouldn't have necessarily gone out and gone, oh, I'm going to go and get myself a coach for my dental career. I went and got myself lots of mentors, because that is like very much part of like the conversation. Like, you know, once you graduate, everyone's saying like, go get yourself a mentor and that kind of thing. And I love mentorship. Like, I think mentors, like, I have so many mentors across so many realms of like professional and personal life. But then also I think there's so much value to having a mentor as well as a coach, because there is a difference between the two, in that mentorship can be like, usually you're getting kind of guidance and advice from someone that's more senior or has more experience than you in a particular area, and is very like domain specific. So you might get yourself a mentor in your dental practice and they give you like certain tips and tricks about that. Whereas coaching, it's like a slightly different relationship where your coach isn't actually there to give you any answers. The coach has actually got like this skill set, like using structured conversation, powerful questions, and eliciting kind of reflection to then help you to find your answers within yourself and draw upon your own wisdom and your own insights. And so that is why I found coaching so helpful for doing things like tapping into your own unique skill set, because that's something that you can't get from someone else or learn from someone else. It's something that you need to look within and then untap within you. So one of the analogies that I like to use when I'm explaining it to my clients is I talk about, in a mentoring relationship, we kind of picture the mentor having the gold. So the gold is like the experience, the expertise, and what they do is they share the gold with their mentee. Whereas in a coaching relationship, the opposite is true, where the coach sees the gold within their coachee, and their job is to help the coachee to see the gold within themselves and then tap into that gold.
I like that. That's really good. I do love analogies. I love looking at the same scenario from a different perspective, so it's far more relatable, because if you've never had a coach before, you are left with possibly an inaccurate concept of the kind of impact that they can have in your life. Have you had various different coaches, not just for dental, but for leadership or management or different, personal self-reflection? Have you had varying different kinds of coaching in your world?
Yeah, I love that question. I get that question a lot, actually. So my first coaching, so as I said, through that leadership program, the coach was, I guess, like very broad, as in we were left to be able to bring anything that we wanted to the coach. But it tended to be around that career side of things, given that it was in a professional setting that we were engaging in. And so I would kind of classify that as like career coaching. And this is where, if you go back to like what I was saying around the coaching relationship, and the coach being there to be a guide, for the coachee rather than giving them an answer. This is why I find coaching especially effective for finding career direction, because that's something that you do need to kind of filter through your own values, your own strength, your own lived experience to be able to make that decision. It's not something you can go up to, different mentors about and then ask them, oh, do you think I should specialize in this? And the answer is, well, I don't know. Like, you kind of need to make that decision on yourself. So I do think that coaching is very powerful in the career direction space. And that's what I work with a lot of my clients at the moment, particularly like younger practitioners that are really wanting to find their sense of purpose and where their niche and where their kind of strength and skill set is. Like, it's really, really fun to be able to help them kind of gain clarity on that. And then you can just see how that's going to have so much impact on their future trajectory, on their belief on what they can contribute to our profession. It's just, yeah, very exciting. As you can tell, I get very passionate about it.
I love it. So I think sometimes we don't even know the questions to ask ourselves. And so when we've got a coach there asking particular questions, we're like, I've never thought about things in that way. I've never thought down that avenue before. And so all of a sudden we are tapping into how we think and feel, but we're not always fully conscious of it.
Absolutely. And you bring up another point that I think is really useful, which is that it's very powerful to even have another person and just kind of intentionally set aside for yourself this time to spend thought, to gain clarity as to what direction am I going and what would I like to see, and empower yourself with that, because life can be so busy, like just, like fighting fires every day and just feeling like we're running by our schedule, our calendars, or our to-do list. And so I can't remember who it was that coined this term, but there's this term about taking balcony time to be away from the dance floor. So dance floor, you're getting kind of like representative of life and feeling like you're being thrown around and just kind of like going to the next thing. And then balcony time is about taking that time out to intentionally take a bird's eye view, decide, do I even want to stay on this dance floor, or do I want to explore a different one? And that kind of thing can be very powerful. And that's what engaging a coach can be really useful for, because then you're investing this dedicated time and energy to be like, okay, I want to like empower myself to see where I'm headed and really like think about my values and what's driving me and where I'm headed and my trajectory.
And it's just, it's to be able to get that shift in perspective. It's such a big thing to try to nut through certain things in our life when we're all amongst the weeds, as they say, amongst the weeds of it all. But whatever we can do to kind of bring ourselves, as you say, up onto the balcony. Now look down, see yourself down there and see what's going on around you. Now have an assessment of what's going on as well. You can come up with quite different thoughts around what your life is filled with and where your direction is.
Yeah, absolutely. And the thing that comes to mind as you share that, you talked about, life, and it kind of relates to the question you asked before around whether I've had other types of coaching, is that what I found is that though the coaching that I received was related to my career, but you can transfer some of the things that you learn from coaching into other domains of your life. So then it becomes more holistic. And so I guess this is like the background of why I actually specifically niched into mindset coaching, is because I found that at the root cause of a lot of things that we experience in life, like whether that be in our personal life, in our relationships, in our day-to-day jobs, a lot of the time, like what the root cause of some of like the tensions or the challenges that we come across can be attributed to how we are perceiving it, what our minds are kind of like the story it's telling us and things like that. And so I found that I'm really big fan, that adage of saying like when you teach, instead of giving a person a fish, like it's best to like teach them how to fish. So I kind of do the same thing with my clients where I teach them how to self-coach themselves. So I teach them a framework that they can then self-apply so that then they can have that skill set and apply it to other areas of their life, even though we might be specifically focusing on career and things like that. And that's the beauty of like the mindset coaching technique, is that the mindset can apply to so many other things. So to give like a personal example, when I started to feel this, I guess, like break through the barrier of some of the self-limiting beliefs about whether I was good enough, smart enough to become a specialist in special needs dentistry, that's what my coach helped me work on. Once I broke through that limiting belief, I then started to go, well, if I can do that, then what else could I do? And so then I ended up, one of the things I always thought that I was terrible at, like from a young age, because you can't see in the video, but I'm like quite short. I like very short legs, never been very athletic.
All I can see is
True. But I've never been an athletic person. And I thought, okay, well, if I can become a specialist in special needs industry, I wonder if I can, run an ultra marathon. because that was something that I had in my mind, like this belief that, nah, you're not a runner, you can't be a good runner because you're too short, you know, you're not athletic, all that stuff. And then to cut a long story short, through, you know, the mindset coaching I received, I ended up running a 105-kilometer ultra marathon, and this was like during my specialist training.
I did
And that
read
was,
that about you too. I've got here, ultra marathon run. I'm like, oh my God, what else has she done? Like, the list just kept going on.
yeah, but that, like, I think so the other mindset piece that I really focus on, especially with my clients, that are, it's all about like finding purpose and clarity as to your values, because I do think that connecting to a bigger vision is what can help you get you through like kind of the ups and downs and give you a bit of a north star to kind of keep you on track. And for me with that ultra running, it was about, I was like fundraising for the Cancer Council, because as I mentioned before, large part of my patient base is patients with head and neck cancer. And I had quite a few patients who were just so inspiring to me, like their stories and their resilience and their compassion for those around them. And I decided that I would make that my big why, and the thing that connected me to going, you know, this is the greater purpose for me, like raising awareness around this issue, fundraising, you know, tangible kind of outcomes for these patients. And so like I've shared this story before, but it always like gives me shivers every time I remember it, is that this is, I think, is a good demonstration of how powerful your mindset can be. Is that like when I was like at the 80K mark, like, so I was like over the halfway mark and really wanted to get past that finish line, but my body was just feeling so much pain. I had already planned for that ahead of time, and my support person, I had given them this kind of like sticky kind of like bandage, which I'd written the names of all the patients I'd looked after who had passed away in the past year, that had been part of inspiring me to do this endeavor. And so I said to him, when it looks like I'm about to break, like, put this on my arm. Wow. And so that was at the 80K mark. He put that on my arm. I read through the list of names, and my grandmother's name was on there as well. And that just filled me with this huge surge of energy, because what happened was my brain, my heart just kind of connected to that. This is why you are doing this. You know, it's tough, it's hard, you're in so much pain, but think about all of the patients that have gone through infinitely more challenging journeys, the people that you could help by being able to get to the end of that finish line. And that just filled me with like the power and the strength to continue going on and cross that finish line.
Oh gosh, I could burst into tears right now. That's an amazingly powerful story. And it really does. It just is such a wonderful way of highlighting the importance of purpose. Because without purpose, that's what life is too. It's just getting out there and running every day, and it's painful. And so, but the purpose is what helps you move through that pain, experience something greater than the pain, and have ultimate control over what you do. And I just read a quote just today. I'm going to see if I remember it. It's something like, you know, you always have to know that you are bigger than your emotions, but it could also be talking about your physical pain. You're bigger than your emotions and you're bigger than your physical pain. Otherwise, it will dominate your life. It will direct your life. You are in direction of your life. And purpose is something that I think a lot of people, some people have it, and some people have it because they've been through difficult things. And so my purpose is driven because of what I've experienced in the past, or it could be purely aspirational. My purpose is this because I really want that. But I think a lot of people are like, yeah, I keep hearing about passion and purpose and values, and I don't know how it applies to my life, but it's something that you kind of need a starting point. This is where a coach can be fantastic as well. Help you identify what your values, purpose, passion is. It may not be the same today as it's going to be in 10 years, 50 years down the track, but start somewhere and then continue to live your life and have it evolve with you. The important thing is to recognize that you're in control. So don't allow avoidance of discomfort to direct where you actually end up going to be and contributing to this world.
Yes, I love everything you said. It's all landing and resonating so much. And in fact, it's like you're reading my mind because and you know, so I haven't told you about my coaching program, but that is literally the first module that I bring my coaching clients
Well,
through.
tell
It's
us a little bit
actually
more about your
yeah.
coaching program and how people can start to tap into you and as this an amazing coach that you can be in their life.
Oh, so basically you had basically like said, inadvertently said like the title of like the first module I bring them through, which is about connecting to your purpose, your values and your vision. So
I love
you
it. I
literally
love it
had
when I
it
read
like
people's mind.
because yes, I think that is like the starting place where we then want to ground ourselves in, and it kind of helps to, I guess, like break down some of the other barriers and fears that we might have, and as you said, gives us this enormous capacity to just continue building ourselves up through some of the more challenging things that we know life will throw at us inevitably. So the program that I run is like through over 6 months, and it's like one-on-one coaching, and there's like worksheets and modules that are worked through. So it's very personalized, but the roadmap is to start with that groundwork of the purpose and passion and direction that you want to head in. And then after that, we work through this framework that I mentioned before around how to self coach. So from a foundation of me providing coaching initially, and then demonstrating the skills, and then working through a framework which goes through how to connect to your thoughts, which is like the mindset piece. But then also another thing that I've actually integrated into my work more recently is around the embodiment and somatic side of things too. So really learning how to fully process our emotions and connect with things on a bodily sensation level. Um, and then after that, how that translates into actions and actually tangibly reaching our goals and the results that that can have on the long term trajectory of our lives. And also, just in that, very much making sure that there is like lots of autonomy for the client to bring any like acute issues or situations that they might want to bring to the table, and just have like a coaching container to be able to work through. And through that, again, that's building their kind of inner belief and them being able to get through any challenges that they have. Also feeling like that support, and also knowing that they're learning the skills to be able to keep this sustainable, so they're not feeling like they're relying on having to have a coach like for the rest of their career, but knowing that they're building up those skills.
I love it. I love it. It sounds like a fantastic program. So much of, I don't know, our experience of life does come back to identity. And I've been having this whole identity thing moving through my brain in various different ways over the last couple of years in a big way. And just that recognition that we will never achieve more than what we believe we are capable of, and what we feel like we're capable of. Quite often, those sort of very core, deeply held subconscious beliefs were installed in our brains when we were very little. And so, in essence, it's, you know, if you don't go back and try to have a look at that and intentionally place a new one in there that's more appropriate to your level of skill and your potential, then it's like having this little child direct you in life. Do this, do that, don't do this, don't do that. And it seems kind of crazy, but we often continue to move through our life feeling like that we're maturing, which we are maturing, but are we actually evolving our mindset along with our age?
Yeah. Oh, I love what you said there, because it actually touches on. I forgot to mention that there is a specific module where we look at unconscious beliefs that are in there. So things that we aren't actually cognitively like aware of, like on a day-to-day basis. But then again, when you take that balcony time away from, you know, the throes of life, you actually realize, oh, there's things like sitting beneath some of the things that are consciously running through our minds. And a lot of that can come from childhood, as you say, and the way that we've been socialized. And you know, one of my like personal kind of like interests is around the concept of intersectionality, and how people who have different lived experiences and different identities receive different messages from society about how we should be and how we're taught to be and things like that. And how sometimes that can cloud your own awareness of what you actually truly desire for yourself, because you've received all these mixed messages from all these other external sources, and trying to work through and filter through what is me and what society is telling me that I should do. And that's something that I think resonates with quite a few of the like dental professionals that I have coached and just spoken to broadly about it, is that sometimes we can feel like life tells us this is the path and this is the way that an oral healthcare professional career should look. And sometimes externally, things can look like they're ticking all the boxes. Like, your career looks like it's on an upward trajectory, that, you've got stability and all those things. But then sometimes there can be an inner disconnect that's kind of lingering and nagging there. And sometimes it can be hard to actually crack that open and have a look at it. But when you are like taking that time to be vulnerable, actually spend some time to look at it, it can be quite transformative in what you say in terms of unlocking and untapping that potential and that extra path that you didn't know existed, and really evolving to the next level of yourself. So I actually see, and I love that you use that word evolve, because I love that word as well, as opposed to just growth, which seems like a very linear path, like it's just about being on the path and then just going on an upward trajectory. Evolving is about potentially completely changing and shifting the way that you think about yourself and you see yourself and your identity. And maybe sometimes it might be completely pivoting, so you actually seem like a completely different version of yourself that you ever imagined, as opposed to just that linear projection of just growing but still being the same person. Like
Yeah, it's the difference between being
yeah.
good on paper only to having, being good in life experience and where you are right now. And that whole, recognition that this is, one of my favorite things is that, constant and never ending improvement. That where you are right now, just always remember, you're never going to get to a point where you go, now I'm there, I've earned it, or I've done it, or I've achieved it. You're never actually going to get there. And it's actually the journey itself, which can be so wonderful and glorious. And I think you've really put across, and I just want to finish off by talking a little bit about the residential facility, because I think it's another example of when you take that step of, I wonder, rather than this is what I'm capable of, this is what my identity allows, I wonder if I was a different version of me, what would I then be capable of? And I've always found that very helpful when I've been doing some identity work, where I can't picture myself achieving that thing or doing that thing. We'll use a classic fear thing, public speaking. I did years of Toastmasters to become a better public speaker, so it's not a problem for me anymore. But it's something that I think a lot of people can resonate with, that when you say to somebody you're going to stand up, and a lot of the reasons why people joined Toastmasters was to do a eulogy or standing up at a wedding and speaking for somebody. Picture yourself doing it. Oh, I can't, I'll be nervous. This is how I respond to that kind of anxiety. I can't. Well, let's just imagine you're somebody else who loves it, who is absolutely satisfied with their performance that they got there. Imagine, so what do you think they'd think? How do you think they'd feel? How would they approach these opportunities to speak? And that's always worked really well for me. Don't picture myself doing it, because that's too hard. I've still got my limited identity to deal with. But if I pictured myself a completely different version, 10 years down the track, where I've actually conquered all of that, how would I think and feel and do then? I find that far easier.
I love that. That's such an effective strategy. It's one that I've used myself as well and recommended to some of my clients. But one of the things, and this is where I've got this interest in like the incorporating the embodiment and the somatic piece as well, is that you're kind of drawing upon, okay, like the what if and the possibility, and you're able to kind of connect to, if you can really connect to the feelings, like the emotions that you would feel, like if you really embodied that other identity, this other thing that seems impossible, that those feelings can actually drive you to then take the actions that other person that you're imagining would be able to get up there and speak, like, confidently, without actually kind of like, it's almost like a mind hack, like you're getting your mind to then be in that space and experience that ahead of time, so that it has the confidence to then catch up and be like, oh, okay, maybe I can be one of those people. So yeah, I love that you use that for yourself.
I've always
like,
found it really good. And it's like, oh, that version doesn't have all the limiting self-beliefs, and so I don't have to worry about them.
yeah. Like one of the versions I like to say to my clients is around, okay, so what about future version of yourself, like you in 10 years time? What wisdom does that version of you have to impart on you about, fear of, let's stick with the public speaking thing, fear of going up to speak. But let's say, and the other thing I like to do is also explore, like kind of like worst case scenario kind of settings. So like usually actually facing the fear head on. So what is it that you imagine as the worst case scenario if you were to stand up and speak in front of audience, and get them to actually verbalize it and articulate it out loud. And then sometimes that takes away the power from it. They go, oh, actually, like, doesn't sound that bad. Or sometimes it does sound really bad, but now it's actually lost a little bit more of its power, because instead of just trying to ignore it or pretend like it's not there, actually acknowledgement can be a really huge step towards then feeling more empowered to then move towards what you desire, if it is to like overcome that fear of public speaking.
That is super powerful, because I agree with you. I think a lot of people think, well, that's what I fear, so that just can't happen. And so what are my other options? But if you're taking them down the journey, okay, well, let's go into what would happen, what that fearful thing, what does it look like? What does it feel like? What are the actions? What's happening? What's going on? And then they are forced to actually verbalize that, and they go, oh, because I was catastrophizing it. Because that's what it is, isn't it? That's what fear is it's catastrophizing the future.
And like one of the things I love to teach my clients as well is like the mindset stuff is about understanding your brain better, because then when you understand your brain, you understand yourself better. And then that allows us to remove this layer of self-judgment that we have. Like a lot of us, I think, have this kind of like critical inner voice that's constantly telling us that we're not good enough, or why are you doing this? But then like if you understand the way your brain works and going, well, actually, like our human brains have evolved over time, but it started off as like, well, we kind of like very lovingly name it the lizard brain. That our brains didn't get rid of it. What it did was it grew the prefrontal cortex, which is the brain that like differentiates us from other animals. The prefrontal cortex is able to plan for the future and other things like higher level executive function. It just is on top of that lizard brain. So we still have a portion of our brain which is telling us the catastrophizing version of everything, because its job is to keep us safe. And it believes that if we keep things the same, if we stay constant, if we don't put ourselves out there, that equals safety. And so it makes a lot of sense that our brains will then start to freak out a little bit when we want to do something like lean into discomfort, because it believes that it's going to be unsafe out there. So by being able to like acknowledge that and understand why our brain is giving us those catastrophizing messages, just releases that level of judgment to go, oh, I see you doing that. I understand why you're doing that. You're trying to keep me safe. However, I also understand that actually I'm not going to get eaten by a tiger. Like, this is not a life or death situation. It is a situation where I feel a little bit more, exposed and uneasy, but I'm actually still physically safe. And so maybe it's something I can lean into. And just having that kind of dialogue with yourself, as opposed to one that's kind of berating yourself for having these thoughts and going, oh, you shouldn't be so scared, and not, invalidating your experience. I found that you're able to really lean into tapping into your true potential when you're actually supporting yourself along the way, as opposed to just kind of, beating yourself up and trying to get yourself to where you want to go that way.
Yeah, because resistance doesn't kind of lead to the next helpful step. And if we're just hating that negative voice, that's more resistance rather than accepting that it's there.
Yes.
And doing something else with it. So, when you were going through all of that, it was wonderful. I was getting this little visualization in my brain of, the comfort zone being here with very firm boundaries, and the lizard brain saying anything beyond that line, danger, danger, danger. Whereas that more evolved part of the brain is saying anything beyond that line is growth, growth, growth.
Yes. Yeah.
So if anybody wants to reach out and contact you, because another element about the special needs dentistry is making sure that even the patients, the potential patients, understand there's special needs dentistry out there as well. You'll have your coaching contact and your dental practice if people wanted to jump on your website and have a look. What's the best way for people to reach out?
Yes. So basically I have everything on like my website, trudysmile.net. So that's the best way to contact me. It's got my email address. You can also find me on LinkedIn, Instagram and Facebook, my socials. Always happy for people to reach out. I do get a lot of messages though, particularly through the social media kind of channels ever since the Queen's funeral invite. So apologies in advance. Like, please excuse if there's a bit of a delay in getting back to you, but I do actually read through every single message and will eventually get back to you.
Beautiful, beautiful. Well, thank you so much. You've been an absolute inspiration. You'll continue doing that for the rest of your life, and the impact that you're going to leave, the imprint that you're going to leave on this world is absolutely extraordinary. So thank you for sharing your story so far with us, Trudy.
Oh, thank you so much, Julie. It was so great to chat to you.
If you enjoyed this podcast, then I encourage you to head over to Amina and my website, dentalbusinessmastery.com.au. You will find all the information that you need if you would like to gain our assistance in helping you and your team achieve great success. We've got online courses, consulting programs, the club membership. We also have a whole bunch of tools and resources that are available for free that will help you achieve your practice goals. If you would like to find out more, you can also email us directly at info@dentalbusinessmastery.com.au. Thanks so much for listening.